about the parasympathetic nervous system. Now, we won't get very far, but I'll introduce this and how it differs a little bit from the sympathetic nervous system. Now, there are long preganglionic neurons in the parasympathetic system, and this is because there's nothing to do with the sympathetic chain, okay? So do not ever talk about the sympathetic chain and the parasympathetic system. They have nothing to do with each other, okay? There is no sympathetic chain. There was no chain of any sorts in the parasympathetic system. Instead, the parasympathetic system has a long neuron that leaves either the brainstem or the sacral part of the spinal cord, travels all the way out to a ganglia that is very close to its effector tissue. And so effectively, we have a longer preganglionic neuron and a much shorter postganglionic neuron. So just the opposite of the sympathetic nervous system, okay? So no synapsing onto the sympathetic chain here, just to a ganglia that is very far from the spinal cord, closer to the effector tissue. Okay, and let's talk a little bit about the cranial nerves that are influencing the parasympathetic system. The most important one is vagus, okay? The vagus nerve, or cranial nerve 10, is one of the longest cranial nerves. It goes from the brainstem all the way down to the gastrointestinal organs. It innervates lots of things on its way down: laryngeal muscles, the heart, the lungs, then into the GI tract, and that's where these are the organs rather that have those parasympathetic influence. Whereas S2, S3, S4 controls the distal part of the colon and rectum, the bladder, and then the genitalia. All right, so most of all of this is done by vagus, very important. Then there's also cranial nerve 3, which is the oculomotor nerve. This controls the eye, right? The eyes and the parasympathetic response in the eyes. The facial nerve, cranial nerve 7, right? We should remember these cranial nerves from lab. And then the glossopharyngeal nerve, which is sensory innervation to the pharynx, okay? Cranial nerve 9. So cranial nerve 3, 7, 9, and 10 control the parasympathetic division of the autonomic nervous system. And then S2, S3, S4 as well, controlling the lower autonomic organs. Okay, now we talked about this. This is the direction of communication. The two types of fibers. Remember, afferent fibers are going from, efferent fibers are going from the central nervous system out to effector tissues. So that general direction is going to be from the integrating centers in the brain out to the heart, the lungs, the glands, okay? Whereas afferent fibers are bringing in information from visceral receptors into the CNS. So think about baroreceptors or chemoreceptors that are on your heart or your blood vessels. They are determining how much pressure is being exerted on your vessel. They are sending information to the brain to determine if we need to increase blood pressure or decrease blood pressure. Likewise, some of our tactile perception, auditory, visual perception is being transmitted on afferent fibers to the CNS as well. Okay,